thrilled to be here today, and it's really exciting for me to hear that this was such a topic of demand in the feedback last year, because I think that probably each and every one of you can attest to that we want to help our children and teens live well despite having a chronic health condition. So today we have a few things on the agenda which just seem to go down. So I want to start off with talking about what the research says. And I know that this can be a bit dry, but I want to clear up any sort of misconceptions about living with a chronic health condition and JIA specifically and what the research says. So I'm going to briefly go through that. So after the research, I want to talk more specifically about what some really common presenting concerns are in children and teens that I see with JIA in my clinic and in my clinical work. And then I'm going to talk specifically more about anxiety and depression. So what is anxiety and depression? How can you identify if your child or teen is having any sort of concerns in these areas? And then I want to leave you with some very practical information. So what does treatment look like? How, as parents, can you support your child or teen with anxiety or depression? As well as some resources that are out there. I'm going to provide some very practical self-help resources, and I'm also going to talk about what kind of resources as far as professional support might be helpful. So let's start with what the research says. So when we're looking at the research of children and teens with chronic health conditions, what we tend to find is that children and teens with chronic health conditions are twice as likely as those same age peers that don't have the chronic health conditions to have psychosocial challenges, including things like anxiety, depression, adjustment issues. However, it's important to know that when we talk about chronic health conditions together, that means that they're clustering a bunch of different chronic health conditions together, and we know that each chronic health condition has their own challenges. So let's take a look at JIA specifically. The one really nice thing is there's actually quite a lot of research on JIA. What we find is when we're looking at emotional functioning, the results tend to be mixed. So there's some studies out there that says that individuals, children, teens with JIA tend to function kind of similar emotionally to their same age peers. So that's good news, right? A majority of them do. However, there does seem to be a subset that's at higher risk of experiencing some of these psychosocial challenges. And those would be things such as anxiety, depression, lower quality of life. School is also another really big piece for our children and teens. So what we know from the research on academics is that generally children, and I'm going to just cluster children and teens together because oftentimes the studies do as well, that they're reporting higher rates of absenteeism. Probably not a huge surprise in here. Okay. And interesting, I actually found these numbers quite astounding. 30 to 50% are reporting very prolonged absences. And some are even saying that they just can't go to school because of the symptoms. We know that severity of symptoms tends to correlate or be associated with school absences. And we know that school isn't just about academics, it's also about social. And we know that children and teens with JIA tend to report adequate social support at school, as well as in their romantic relationships, which will hopefully be with the older teens. So the other piece that I wanted to just kind of give a very general overview of is long-term emotional functioning. And what we know from the research is that in general, individuals who had JIA and their as children and teens tend to report higher physical impairment when they're older, but it's a bit more mixed on psychosocial adjustment. So there's mixed findings on long-term emotional functioning, with some saying that they're very similar to their same age peers in the long term. Others are saying that they're more at risk for anxiety, depression, other psychological disorders. They tend to have similar academic achievement in the long run as their peers. Similar spousal relationships, I know that probably breaks your heart to think about that. Like, they will grow up. Similar spousal relationships to peers. And there's mixed findings on long-term employment rates, with some support saying that there's lower rates of employment in the long run. But again, I think that it's important to know that these are groups of people. Your children and teens are individuals, so keep that in mind. We also have some more recent research that looks at the impact on families. And I know I'm talking to experts here in the room. And what we know from this research is that that it is a bit mixed in the findings. So parents tend to report increased emotional distress in general and lower quality of life. They're also reporting some very disease-specific stressors, which my guess is you probably can relate to some of these. Worries about their child's future, school. Also, there's a financial burden, lost day from work. I know that, if there's a lot of school absences, oftentimes parents are staying home, they're having to take time off. They might even have to quit their job. And problems managing the treatment regimen. The nice thing is, the good news is that actually most families who have children or teens with JIA are reporting very good adjustment and good family cohesion and low family conflict, which is a protective factor for these children. Siblings tend to be more vulnerable to emotional distress in general, based on what we know from the research. So the siblings, sometimes the adverse experience of the affected child, the child with the disease, can have an emotional toll on the sibling as well. So we can't forget about siblings in all of this. They're reporting higher emotional distress in general, and also lost time from friends. So some take-home messages from the research is that most children and teens with JIA are functioning as well as peers socially, emotionally, and academically, which can be attributed a lot to family, right? We do know that there's a subset who are more vulnerable to experiencing emotional distress. Those with more severe disease symptoms are more at risk. But we also know that family cohesion and kind of that family support can be a huge protective factor. And the fact that each of you are here today is a really good indication that you're doing everything you can to support your child and teen. We also know that it's not just the child or the teen that has JIA, it's the entire family that this affects. We know that siblings are more at risk. We also know that there's a huge parental burden. So I want to talk about some common challenges that I see. So anxiety is a very, very common challenge that I see in my clinical work. And this can be individuals who are coming in just with kind of a general tendency to worry. It could also be disease-specific anxiety. So, oh no, what if I have another flare-up? What if I have to miss an activity? What if my friends don't believe me? So it could be very disease-specific as well. And then, of course, we also have the procedural anxiety that can happen. Needle phobia is a really common one with JIA. Mood symptoms, or what we oftentimes refer to as depression, is another really common challenge that we see in my clinical work. Pain and symptom management is another common presenting concern, and treatment compliance. What we know with treatment compliance is that individuals who take oral medication, they don't tend to have as many challenges with treatment compliance. However, it's oftentimes when injections come into play or with the blood work. And we know that it's not quite as simple as they don't want to. Oftentimes anxiety is playing a huge role in that, right? So we want to make sure that we're understanding the big picture. So while pain and treatment compliance are a very common concern, today's topic, we're going to really focus on anxiety and depression. So I want to talk a little bit about what anxiety and depression are. One, because you as parents are most likely going to be the first people to identify that there's a challenge. And so there's some things that we want to be aware of and some red flags that we want to look out for. And with children and teens, it doesn't always present as, them coming to you and saying, oh, I'm feeling so worried. It comes out in other ways, right? Some of them that aren't so fun to be around. So when we talk about anxiety, I always want to give some perspective that anxiety, worry, it is a completely natural emotion. And each and every one of us have those emotions on a daily basis. The difference is that when we have this worry alarm, it can actually play a very protective role. Has anybody ever thought of worry as a good thing? So what's a good thing about worry?
Moves you to action.
Moves you to action, right. So probably if we didn't have worry, we wouldn't go to work, right? Because we'd much rather stay at home and hang out with our kids, or maybe not hang out with our kids and stay home. But we worry about getting in trouble, right? All right, I saw a hand over here. What's another good thing about worry?
Just protect safety.
Yeah, exactly. If we didn't look both ways because we were worried about getting hit by a car, we probably wouldn't make it too long. So worry can be very protective. It can be a huge motivator. The problem is that sometimes if we think about it as an alarm, some people's alarm goes off much more quickly. And so they're a little bit more sensitive. It's like a fire or smoke alarm. Whenever I make toast, my smoke alarm goes off in my house. It's a false alarm. There's no fire. And it's the same thing with some kids and teens and adults. So I oftentimes think about anxiety on a continuum. We have very adaptive anxiety and ranging all the way to maladaptive anxiety. And it can be really hard to figure out when it kind of crosses that threshold to being a problem. And it can be really sneaky, and it can be really inconsistent. So sometimes it can be really hard to determine whether you need to get some more help. We also know that there's a lot of individual differences in the way people experience anxiety. And so that's why I want to explain a little bit about some of the very common ways that we see in children and teens. So when we're thinking about anxiety, we have three components of anxiety that we oftentimes focus on. One, we focus on the bodily reactions. Young kids are pretty good at identifying bodily reactions. They know that when they get worried, their body reacts. We also think we want to focus on thoughts, because the thoughts can actually feed the anxiety. And then we also want to focus on behaviors. So who in here has a dog? Who in here has time for a dog? Who in here walks their dog? All right. Who in here has encountered a skunk when you're walking your dog? All right, can I use you as an example? All right, let's use you. So what happened as far as your body reaction goes when you were walking your dog and you encountered a skunk?
We've encountered it before,
so you don't have a huge reaction. Okay, well, I had a dog, and I encountered a skunk, and my sympathetic system kicked into gear, and my heart was pounding, and I got hot, and so we had very different reactions. What were your thoughts?
I didn't want to get sprayed. I didn't want him to get sprayed, and I didn't want to sleep outside with the dog.
All right, predicting the worst future. All right, and what did you do?
Got him out of those quickly as I could.
Okay. And he didn't get sprayed? Did you run? Okay. So when I did that, I was like, oh, blank. I need to get out of here because I don't want to get hit. And I ran, which probably actually startled the skunk a little bit more, right? Thank goodness I didn't get hit. But it just kind of shows that we all have different reactions to certain stimuli. So with some common bodily reactions, what we want to do with our kids and with our teens, as well as ourselves, is to really get to know our anxiety and our mood symptoms and how it impacts us individually. So some really common ones would be rapid heart rate, difficulty breathing, upset stomach. In fact, that's one of the most common things that we hear is kids aren't saying that, oh my gosh, I'm feeling so worried. They're saying, oh, I feel so sick. We also know that pain is not separate from the brain and body. And so we can actually see an increase in pain symptoms, so more complaints of muscle tension or pain, sweating, shaking, trembling, fatigue. Those are all really common ones. So going to anxious thoughts, I always think of it as like we have this worry monster, and the anxious thoughts can either tell it to be quiet, or it can actually feed it and make it bigger. And so oftentimes what we see are anxious thoughts that are feeding it. So what if people think I'm faking? What if the pain gets worse? What if I have to miss an event? What if my friends know? It can also be frightening images. So it could be memories of a trauma. So, oftentimes with younger children, they might have to hold kids down to get injections or get blood work done. It could be that. It could be an image of an anxiety-provoking situation. So maybe a friend was not nice to them, they were teasing, they were laughing at them. So it doesn't always have to necessarily be thoughts. It can also be visual images. We also know that there's behaviors. So really common behaviors that we see in individuals who are anxious is avoidance. So sometimes you miss a lot of school, and it's actually really hard to go back to school after missing a lot of school, and so they want to avoid going back. And it can become this vicious cycle, right? Because the more we avoid, the more we get that satisfaction of not having to feel worried. And so it just kind of feeds the worry. It makes it worse. Withdrawal, escape, they just want to get out of the situation. I don't know whether anybody in here has any kids who hate to get blood work done. They can run really fast, right? Distraction, oftentimes kids will say, I just don't want to feel, so they might be on their phone all the time. They might be on their computer. They don't want to feel those really uncomfortable emotions. Sometimes kids will have compulsions or rituals. They have to do something to calm down their anxiety. The other thing we tend to see a lot is a lot of reassurance seeking. So they might be asking you as parents, is this going to hurt? Are they going to keep me in hospital? Is my treatment going to change? So a lot of seeking reassurance and resistance to change. Anything I missed there? Okay. So depression is very similar. So we oftentimes want to look at those thoughts, behavior, and physical reactions when we're talking about mood. Really common ones for depression for physical symptoms would be headaches. It can also include stomach aches. We know that there can be an amplification of pain symptoms, chest pain, pressure, digestive problems, exhaustion, fatigue, sleeping. This could be an increase in sleeping. Maybe they can't get out of bed. It could also be sleep disruption. So difficulty going to sleep, disrupted sleep, as well as changes in appetite and weight. And again, it can kind of go both ways. It could be an increase in appetite, also a decrease in appetite. So just changes in general you want to be aware of. Thoughts can also have a huge role in feeding those depression symptoms. Some very common thoughts that we see in individuals with depression would be negative thoughts about themselves, about the world, and the future in general. So we want to really get at some of those underlying thoughts that are contributing to the depressive symptoms. We also know that there's this vicious cycle that I want to say children and teens, but also just people in general can get into when they're feeling depressed. So some really common behaviors that we see are irritability in our teens or children, changes with sleep, appetite, like I mentioned before, difficulties concentrating. Sometimes the thoughts are so bombarding or they just feel so numb that it's really hard for them to concentrate in school, do their homework. Changes in grades, crying, withdrawing, maybe they're not hanging out with their friends like they used to. They just don't find satisfaction or joy in the activities that they used to do. And unfortunately, with both anxiety and depression, there can be self-harm. So as parents, we're always trying to gauge whether this is typical, because we all feel sad, we all feel worried, we feel a range of emotions, and in fact, we want to feel a range of emotions, or whether it's something that we need to be concerned about. And so oftentimes, it's important to think about, I use a few different things to differentiate. Sometimes we have kids or teens who come into the world with an anxious temperament. Like maybe they're quiet, maybe they're shy, maybe they just tend to be a bit worriers. And we also have some people who present just kind of as flat. They don't show a lot of range in their emotions. So temperament can just be something that we're not going to change that. We also have developmental worries as well as sadness that happens. So if you think about childhood, some very typical presenting worries would be fear of separating from parents when you drop them off at daycare, or when they're starting something new. It could be irritability when they're going through hormonal changes. And so I feel like we don't want to pathologize some of these very typical developmental concerns that happen. We also know different situations can happen that can lead to an increase in anxiety or worries as well as sadness. So any sort of changes, so parents get divorced, grandparents die, any sort of changes that happen, stressful events, starting a new school year, this is a pretty opportune time for there to be a little bit more worry. New or unfamiliar situations can be really hard for people, as well as those losses. The real big thing that differentiates between excessive and typical is that usually with these scenarios, it's manageable with support, and it tends to get better. So it's a bit transient. Versus when it's excessive, it's often that we see a very acute change, or they don't kind of progress through what we would consider typical. It sticks around. It becomes a bit stagnant. It can be persistent, and it can also, I always think about functioning, no matter what I'm talking about, because if it's interfering with medical issues, if it's interfering with school, friends, so it kind of permeates their functioning and can really get in the way of it. If it's disproportionate to what the trigger is, or it can even happen in the absence of a trigger, that tends to be more on the excessive side. As well as when we try different strategies, you try to support your child and teen, and you just don't see the progress that you want to see, then maybe it's kind of going into that, crossing that threshold into excessive. While I'm not going to focus a lot on pain today, I do want to just mention again that the mind and the body are so connected. And I think it's really hard when you have a child who has a disease that is kind of marked with pain, because we know that actually depression and anxiety can amplify the pain symptoms, which makes it really hard for parents to know whether this is something else, or whether it's just a disease, or whether it's likely a combination. So, what are your questions about or comments about how to identify it? Pretty straightforward on slides. A little bit trickier sometimes when it's your child or your teen. So I want to go more into what do we do with this? And when I talk about what we're going to do, I want to talk about some of the empirically supported treatments and some very practical suggestions about what you as parents can actually be doing at home to support your children and teens. And I think even though we're focusing on depression and worry, I don't think it has to be at the clinical level to do these things to support your child. So even though that's the focus, know that these are applicable to pretty much, and will be helpful to pretty much every child and teen out there, as well as probably every adult. So while I'm going to bring in what we know about the research and what we oftentimes do in treatment, I actually want to open it up to you, because Many of you have probably been living with JIA in your family for a long time. Maybe others, it might be a little bit newer, but I'm amongst experts. And so I want you to take a second and I want you to think of one thing that you as parents have done to either support your child to live well with JIA and or something that your teen or child has done to help themselves. And let's write some of these down. Awesome. So empowering your child, giving them the words, giving them the tools to be able to kind of take the action to keep themselves safe as well as healthy and thriving, while also trying to create this normalcy. I would say that with some kids, that requires a very titrated, like gradual, where we would work with the school a lot for ways that we could communicate that they need to take a break without them standing out a lot, versus other people are great standing up. So it's really individual and what's going to work best for your family. So I do want to talk a little bit about treatment and what we know from the research. I think you actually got a lot of these. I'm amongst experts, like I said. So what we know for depression and anxiety specifically is that we have a couple of treatments that research says work really, really well. So one is cognitive behavioral therapy. Who in here has heard of cognitive behavioral therapy? So we're going to talk quite extensively about it. Oftentimes referred to as CBT, as well as medication. They show huge improvements in anxiety and worry, or anxiety and sadness in children and teens. What we know about CBT is that it's not only associated with large improvements, but it tends to have more superior long-term effects than medication. And so oftentimes when people stop taking medication, the benefits go away, so the anxiety might increase, versus if we're giving them the tools and kind of building their tolerance to feeling the worry or finding ways to better manage the symptoms, then it tends to be longer lasting. So for this reason, it is the first line of treatment. We also know with medication there are some side effects that can happen. And so with children and teens, we want to be extra cautious. And we also have to think about the range of other medications that they're on. With medication, it also has large improvements. It can be used in combination or alone with CBT. So I find that the way I think about medication is that sometimes it's actually a huge benefit to have medication to boost kids up to a place where they can actually engage in treatment and to get them to a level where they can start to learn the tools. Because when we're talking about depression or paralyzing anxiety, which unfortunately does happen, that it's actually really hard to engage in treatment. And then we can gradually work on decreasing the medication. With some people stay on medication a long time. But that's usually not the case. Usually the CBT is the very first approach that we would try. So with cognitive behavioral therapy, one of the reasons that we want to pay so much attention to the different symptoms is that treatment is really going to target each of those areas. So when we're talking about CBT being the gold standard treatment, what we're actually talking about is increasing children, teens, parents' awareness of what some of those thinking patterns are that are either feeding the anxiety or the worry or the anger or whatever emotion is presenting, and also working on changing some of those behaviors that might be maintaining those symptoms. So we're going to talk about it a bit more in depth. So oftentimes, like I was saying over here, is that before we figure out how we're going to treat something and what's going to be effective, we actually have to know what we're up against. So you don't go into a game without knowing anything about your opponent, and it's the same thing for when we're treating anxiety and depression. So this is a lot of things that you can be doing at home. So when we're talking about psychoeducation, we actually really try to normalize emotions. We all feel these range of emotions. We introduce anxiety using that alarm metaphor, where some people's alarm is just extra sensitive and it has a tendency to go off too easily. We also talk about that connection between the triangle, that thoughts can actually feed the anxiety, make it worse. It can actually, if we're having thoughts like, oh, this is going to go horrible, nothing's going to go right, it's going to be so painful, then actually it can increase physical symptoms, it can impact our behavior. So just kind of the relationship between the different points on the triangle. So we're going to make our children and teens become experts on their emotions. And we try to do this in fun ways. So we focus on what's the situation, what happened, what did I do, so the behavior, what was I thinking and what was I feeling, and how did it impact it. Oftentimes when we're talking about emotions, we're talking about it using a scale. So I'll oftentimes use a thermometer as kind of the way to communicate how intense the emotion is. I can use colors when it's a young kiddo because they tend to respond better to colors. So we have to adjust it based on developmental level. And then part of treatment might be targeting thoughts, it might be targeting physical symptoms, and it might be targeting the behavior. With CBT, for the treatment of anxiety and depression, usually it's really focused on the thoughts and the behavior. However, sometimes we do target physical symptoms. So this could be things like progressive muscle relaxation, which is a tool that we can use to help children, teens relax their entire body by tightening and releasing and walking through the entire body. I can often do it once they become experts at relaxing, where we do a quick and dirty one where they tense up their entire body and relax. This can be really great for pain. Deep breathing, so I heard box breathing is one that you have used as a tool. Oftentimes with younger kids, we teach them to breathe by blowing bubbles because it's a very concrete way of them knowing whether they're taking full breaths. Mindfulness, which I know was a topic well attended last year at the conference by Dr. Vo, who talked a lot about it. Exercise is one of the best treatments for anxiety and depression because it gets those natural endorphins going. And we also know that imagery-based relaxation can be really helpful. I find either kids love relaxation or they hate relaxation. And so usually if they hate it, I don't push it on them. Interestingly, oftentimes people will say, oh, just relax if somebody's feeling worried. Who in here has actually given birth? And somebody says, oh, just relax. Well, what do you want to do? You want to punch them, you want to do something really horrible, right? I want you to give yourself a bit of perspective because oftentimes when kids are feeling really anxious, it is that intense that they want to have the same reaction. And quite frankly, it might be impossible to relax when anxiety is that high. So whenever I hear parents saying, oh, just relax, I'm like, I don't think they can right now. So we want to actually build up their tolerance to tolerating anxiety, which I'm going to talk about. So the other component that we oftentimes focus on are the thoughts. And so I love this. This is something that actually a patient of mine came up with. And so it's how we interpret events that makes a big difference in how we cope with them. And so this person has a fast heartbeat, and they say, oh, this is so exciting. This person has a fast heartbeat. Oh no, I'm having a heart attack. Same experience. They're both going on the same roller coaster. And they interpret the experience so different, and it takes on a whole new meaning. Thoughts are so powerful. So when we target thoughts with our kiddos and teens, it's really about identifying what thoughts are not helpful and what thoughts are unrealistic. So what our teens and kids tend to do who have a tendency to worry or who are having some mood concerns is that they over-evaluate in a negative manner. They tend to be hyper-focused on the things that don't go well, and they tend to predict that things aren't going to go well at all, right? So we want to come up with more realistic thoughts. And I always tell kids and teens that we're not telling them to put on rosy glasses and say everything is perfect, because that's also not realistic. And so what we want them to do is be realistic in their thinking. The way we do this is going to differ whether we're working with a younger child, or whether we're working with a teen, or whether we're working with adults. So I want to just give you a little bit of an idea of what that might look like with younger children. Oftentimes we externalize the worry, so we take it away from them, and we talk about it being like, you probably have heard of worry dragons, worry monsters. I let them come up with their own name. I let them draw it. I let them create it with clay. So that way we know it takes it away from them a bit. Younger children have a hard time identifying their thoughts. So if you ever ask somebody what they're thinking and they're like 5, 6, and they're gonna say, I don't know. And they probably actually don't know. And so instead of trying to like kill ourselves, trying to get them to come up with what their worry thoughts are or what their sad thoughts are, oftentimes what we'll do is we'll just focus on helpful thinking. So if they're going to get blood work, we're gonna give them some skills about coaching themselves, like I can do this, I've done this before, this is gonna be quick. So coming up with helpful thinking statements as opposed to really identifying what the worry is. So oftentimes we'll have them do some detective work. Oftentimes, especially with the kids who are really into like Harry Potter, and they love this because you can make a bit of a game out of it. So really finding what the evidence is to find out whether that worried thought is true or whether that sad thought is true. So if they're saying, you know what, nobody likes me, nobody wants to play with me at school, well, let's actually go and get the evidence for this to see whether this is a true thought or not a true thought. Teens, probability testing, oftentimes with kids who worry or who are sad, they kind of overestimate the probability of something happening. So we would have them figure out what the probability is, do some research, and behavioral experiments. So this is if somebody thinks something's going to happen poorly, we actually send them out to do it. And we get them to do some probability ratings beforehand, and determine or to identify what they think is going to happen. They go out and they do it, and then they come back and report to us. So we really try to test concretely some of the thinking patterns. Now, the last part is the behavioral piece, and this is the nuts and bolts of anxiety treatment. So if you're going to get support for your child and they're not doing exposure, then there's a huge component missing. So unfortunately and fortunately, the best way to manage anxiety is to build your tolerance to anxiety. There's some situations, some individuals who are always going to worry or that are going to be anxiety provoking. And so what we need to do is we need to build tolerance to it, meaning that we have to face and we have to do what we fear most. Now, when we do that, we do it in a very gradual manner. So we would gradually work up toward the feared situation. So if it was going to school, for example, we might start off by going and standing on the front step for 10 minutes. And we might do that repeatedly until the anxiety comes down. Then we might go into going into the school after hours. Keep doing it until the worry comes down. So we would gradually work up to going to class. And that's going to be the same for any sort of worry that child or teen presents with. The other thing too is exposure work can be extremely fun, and we can build in rewards to increase motivation. You have to be quite thoughtful in how you actually do exposure work. So we create a fear hierarchy because it's really common in JIA. I actually came up with a fear hierarchy for what it might look like for doing exposure work for somebody who has needle phobia. But remember, this is transferable to any sort of worry. So it might be that we think about getting a needle. We would keep doing it until anxiety came down. Then it might be having a needle in the room, working our way up to holding a needle, working our way up to maybe even touching the needle on our hand, working our way up to me giving a doll a pretend needle, and so on until we get the blood work done. So we're doing it in a very gradual manner. Whenever I'm working with kids or teens on what the hierarchy looks like, they are very involved in what the steps are. And we're also coming up with ratings. So I'm not going to be moving on to the next step until that initial rating of anxiety has dropped by half. So I will repeat until it's done. Exposure, like I said, is the nuts and bolts of anxiety treatment. The thoughts can be really helpful, but unless you're doing the exposure, you're probably going to have very limited progress. I love this. Somebody who has a fear of snakes, dark places, and enclosed places. This is not what treatment looks like, just so you know. We do it in a very gradual manner. For depression, we also want to focus on behavior. Oftentimes, people get into very vicious cycles. They withdraw, which in turn makes them feel more isolated, which in turn makes them feel like nobody likes them, which in turn makes it so they're more likely to feel more depressed. And so what we want to do is we want to actually break the cycle. And similarly, we actually can come up with a ladder similar to the exposure work, but with behavioral activation. So ways to break that cycle. So it might start off with eating meals with families, getting out of the house at least once a day, attend first period. I think that oftentimes what I find is parents want so much for their children to kind of be the person they used to be, and they want it to happen really quickly. And what we know is we have to work really collaboratively with children and teens to make it at a paced manner that they're actually going to engage in it and that it's not going to be overwhelming. So just a few resources that I want to share with you, because you can start this today with your child and teen, which is awesome. And you can start this and it's going to be helpful whether your child or teen is having clinical levels of anxiety, depression, anger, whatever emotion. Anxiety BC, probably the best anxiety resource I've ever seen, and it just happens to be based out of British Columbia. A lot of, there's an area for parents. There's an area for adults, if you yourself are having troubles with anxiety. There's an area for teens that's very interactive and teen-friendly and up-to-date, as well as just a lot of resources. Dealing with depression, it's a manual that's actually local. You can Google it and find it for free online. These are two books that I oftentimes recommend for parents. Very practical suggestions on how to support your child if they're having anxiety. I especially love this one just because it's so practical. It gives you really great ideas about what language to use. I just love how practical. It also goes over various different anxiety disorders. So whether it's separation, whether it's generalized anxiety, whether it's a specific phobia. So it covers a lot of different areas. But I love that book. This is a great book. If your child is doing a lot of reassurance seeking and trying to get you to engage, and there's a potential role that you might be playing in feeding the anxiety too. We also know that parenting a child with a chronic health condition is a whole different ballgame, right? The things that you have to support your child through is very different than what most parents have to do. So here's a couple of resources that are specific to parenting a child-teen who has a chronic medical condition. This one's a great practical guide for procedural anxiety, so injections, blood work. What did we? Yep, these are books. Yeah. So the Anxiety BC website is not a book, it's a website. The Dealing with Depression is a workbook, but it's downloadable from the internet, and the rest are books, yeah. So going back to that, when do I get more help versus when is it just kind of typical and can I support them on my own? Oftentimes I find that, you know, you read these resources, you get some really practical ideas as parents. You yourselves can probably support your teen, your child. They can support themselves. A lot of these are resources that are great for teens as well, the Anxiety BC's website especially. And they might be able to manage just fine. However, there are times when we might need to get a little bit more support. So if they're significantly interfering with their functioning, whether it's at home, whether it's at school, whether it's socially, then it might be time to get some more support. Also, if after you've tried implementing some of these strategies that we've talked about today, and you've looked at the resources, and there's continued challenges, you're not finding them that helpful, then it might be time to ask for some extra help. And lastly, if it's getting in the way of any sort of medical intervention, then it's probably time to get some help. So those are just kind of some ways that I determine when to tell parents, like, yep, maybe it's a good idea that you come to see me, or you probably don't need me at this time. So I want to turn it over to you, and let's talk about what questions you have. Oh, actually, these are a couple of other resources. If you do decide to go get some support, the private psychologist, there's a Psychologist BC website, which is our college, that you can actually look up people. I would recommend that you get somebody who has a good understanding of the medical piece as well. There's quite a few medical psychologists out in the community, just because it does add this extra component. And also somebody who practices evidence-based practice. Don't be afraid to ask questions on the phone, like, what approach do you take? How long are sessions going to be? Ask a ton of questions, because you're going to be paying some money, and you want to make sure to be paying that money to the right person, right? Also, child and youth mental health. They have some free services in the community, and I put up you can just Google the website, and it gives you information about how to access those services.